Good afternoon. And today I have a pleasure of interviewing Dr. Jason McKeown. Good afternoon, doctor.
Hi. Thanks for having me on the show.
And thank you very much to our audience. If you have trouble sleeping, this program is for you because we're going to talk about drug-free insomnia strategy. What you can accomplish with this device called Modius, invented by Dr. Jason McKeown. And if you sleep next to somebody who have trouble sleeping, then this program also going to be for you because you can help or educate your partner and make yours and your partner life better. If you're a medical professional who, just like us, want to find holistic approach to treatment strategy available to our patients, then this program is going to be for you because we're going to talk about that holistic approach, drug-free insomnia and anxiety approach today with this beautiful device. And I want to tell a story how I met Dr. Jason McKeown and learn about neurovalence and all of that. So as you know, I interview a lot of medical doctors, and medical doctors, especially sleep doctors, they might be in sleep because they do have trouble sleeping. So they all mentioned to me, I asked them, what's your strategy for insomnia? And they all mentioned, this is our strategy for insomnia. Yes, as a doctors, we understand some side effects of the drugs. It's not a unicorn and it's not a magic wand. It has a benefit and it has negative effects as well. So they're all using that. And I got so interested because I do have my trouble sleeping. And yes, I don't want to take a pill if I can avoid it. So I got in touch with Neurovalence and with Dr. Jason McKeown, and I got my magic remedy for sleeping, and I was impressed with the whole story. But this device was invented by a doctor who practiced and I guess saw the same problems like I do see in my sleep practice, or I do see among my friends. We live very fast lifestyle and it's very difficult to unwind and when we need to do and relax and fall asleep. So he come up with that device, but he's actually UK trained doctor, a neuroscientist, and he's very passionate about technology. And then he spent years in research and development, and he had a beautiful team of people, and they got, he invented the device, put this whole thing together. And I know it's very difficult because I interview some other inventors on my channel. It's a very challenging, rocky journey. And he got FDA clearance in the United States. So now this device, help a lot of veterans. But very shortly, it can be prescribed device, and any patients who have insomnia, suffer from insomnia, suffer from anxiety, can ask the doctor and get maybe different version of that Modius device, Modius Calm and Modius Sleep. So Dr. McKeown, he's going to talk about that, but he has a lot of academic background in the Department of Psychiatry. He holds the position there, and he worked in the National Health Service and Royal College of Emergency Medicine. So he has a lot of affiliation, but he's very credible. Now, my question to you is, like a first question, what inspired you and how life journey brought you to invention of this device?
Yeah, I think you've already touched on this. The issue with drugs, it's universal. So I practice medicine in the UK. I know it's a problem here in the US as well. But whenever I was at one point in my career, I was actually based in a hospital that's seen a lot of elderly mental health patients, and lots of these people struggle to sleep. But what options do you have? And it's particularly dangerous giving these Z drugs or narcotic type drugs or sedatives to anyone. But whenever it comes to elderly people, it can be extremely detrimental to their mental health, their cognitive health, their physical health. So I really just disliked the fact that I had no choice, and patients felt they had no choice, and you almost felt pressured into just doing something, which resulted in just another pill being prescribed. So when I was always, my mindset was always looking for, would there be a drug-free way to approach this? And not even, although insomnia was our first interest, across the spectrum of mental health, could we actually have drug-free treatments, maybe for like anxiety or even into like PTSD? And so I was always looking for this opportunity. And then, long story short, I got invited out to study neurostimulation at UCSD, or University of California, San Diego. That was in 2016. And we created the technology there that allows us to turn on these central deep parts of the brain using totally drug-free, totally non-invasive. We use a little tiny electrical pulse, and we can actually turn on the little parts in the center of the brain that control how your brain actually regulates your sleep. So traditional medical device kind of approval process after that, we got some grant funding, we got some commercial funding, and we spoke to the FDA many times. And then about a year ago, or just over a year ago, as you say, we got our first FDA clearance, and that was our Modius Sleep device, which is a treatment for chronic insomnia.
So tell me, I put it on me, but how does it actually work? Can you give us in simple terms? Yes, we understand from your explanation, it stimulates deep areas of the brain, but how does it happen with this, I would say, band and two electrodes attached to that, and I have clips to put them behind my ear? Yes. So how does it work? What exactly happened?
The analogy that I sometimes give is like plugging a USB cable into your computer and connecting one side to a computer and one side to the printer. So the computer is like this little part, and in here is all the electronics, and it generates a little signal which goes down these little cables. But whenever we attach this, we stick it onto the skin just behind the ear, and there is a nerve. It's your vestibular nerve. It's part of your inner ear. That nerve actually is right at the surface. So whenever we apply electricity to that nerve, like the USB cable between your printer and your computer, we can send signal right down the nerve and actually turn on parts of the brain which are deep in the brain, using this connection from the surface. So essentially what we've done is we found a way to turn on the center of your brain entirely non-invasively from the surface, and this little device is what we created then to do this. So for 30 minutes a day, you wear this, not when you're in bed, you wear this before you go to bed. Maybe you're watching television, you wear this for 30 minutes, and it applies that little electrical pulse, and it repeatedly turns on the control center for the part of your brain that essentially regulates your sleep. So day after day, we are almost, if you imagine like strengthening that part of your brain so that with time you actually restore normal sleep. So our goal is to actually fix the problem, not to sedate over the top of it. And as I say, we can do that by that 30 minutes a day for even a period of a couple of weeks, actually, and then you start to see the normalization of sleep again, and people see a big response to their insomnia.
I have a question. As I mentioned before, you have Modius Sleep and Modius Calm. What's so different between those two? Or it's essentially the same device, just you use it, in a different time?
So our second approval, or our second FDA clearance, was for Modius Calm, and that's indicated to treat adults who have generalized anxiety. So that's a huge proportion of the population, unfortunately, of generalized anxiety. What the patient experiences is exactly the same. It's this piece of technology. The little clips go on. They watch television for 30 minutes, but the key difference is that the computer inside here actually activates a different part of the brain. It's a slightly different part of the brain which controls how you respond to stress. And that's done through the pulses and the frequency and the shape of the current and the voltage. All of those are configured differently to activate a slightly different part of the brain. So our first approval was, as I say, Modius Sleep for insomnia. And then we were able to reconfigure what the device does and get it approved then as a second treatment for generalized anxiety. And the interesting thing about that is, as you well know, those two issues are so interrelated.
So interrelated. That's why I
Yeah.
thought, yes, I understand you changing the wave, the
Yes.
frequency of the wave, but it's
Yeah,
very
so
much related. Usually people who can't sleep, they become very anxious, and people who are anxious, they have a lot of trouble sleeping.
exactly. It's a very similar. It's almost the same part of the brain, but we just ever so slightly we can activate slightly different parts. So we can improve how your body manages basically how it responds to stress. But that is related to how you sleep actually. So that's why those two devices are similar.
But I know we both don't live in a magic world. So a lot of people, over the years, they develop a certain routine using medication, CBD treatment, meditation, like they have it. So with this device, what are your recommendations of combination therapy, or maybe tapering the medication? What's the safest way to do that? And number one, we, usually, yes, people like the routine, but in the same time, if you can get something better, why don't use something better? Or maybe a routine help you, 50%, but you can add something else and get even better. So doctor, give us your recommendation of combination treatment and tapering medications.
Yeah, I would say actually there is likely to be quite a synergistic effect. So it's not a case of that we want to replace what you're already doing, or we want you to stop, say, your evening routine that maybe works well for you, but you just want to get better sleep. So at the initial stage, we would say add this in and maybe don't make too many changes. And that's actually how we looked at our clinical trial. So at our clinical trial, we asked people not to change anything, not even their coffee in the evening or their caffeine intake. We just wanted to see what happens when you add this device in. And the data is really clear. It improves insomnia. So over a period of 4 weeks, but certainly around 2 to 4 weeks, you start to see big improvements with insomnia. But that's in the clinical trial. But in the real world, what we're finding is that patients who actually use this as part of their routine get an even better outcome. So patients maybe who are doing some type of CBTI or maybe have like an app to help them kind of unwind, or there's like phototherapy, meditate. There's all of those things. Actually, we're seeing synergistic effects. So we are very happy to say to patients, look, just use that and see, and if you feel it helps, great. And then the other thing that we're seeing, and actually we're looking at another clinical trial for this, is we actually want to taper patients off drugs. So we want to get another FDA approval, which specifically says if you want to reduce sleeping pills, you can use our device. Now that's obviously at a trial stage, so I can't make any kind of claims about it now, but what we believe will happen is that if you start tapering down your drug use over a period of probably about 4 weeks, not very fast, you don't just stop, it's a slow taper down. We believe that the Modius Sleep device will impact that, so your results are much better and you get a better outcome. But we don't know if that's correct at this stage, so that's what we're going to look at in our next trial.
This is wonderful. But do you have specific practices, besides the medication or, your standard, what you recommend pairing up with this device? Like, you mentioned caffeine or you mentioned screen time, those are standard things. But do you have anything what you can say, if you're using this, do that, and that's going to make your sleep better, besides the routine?
Yeah, so we don't push this on patients actually. So other than a good sleep hygiene, so everybody kind of knows, there are certain things you do and you don't do before you go to sleep.
Yeah.
So we would say good sleep hygiene. But one thing actually, I don't think I mentioned this. So our devices are prescription issued devices. This is not something that you can just buy. So your physician and you as a patient should be talking about all these things and saying, hey, look, here's the problem. I'm waking up too early, or I can't get to sleep. And it should be an ongoing dialogue with your physician to really look at the solution that's best for you. And we're actually really keen to leave it in the hands of the physician or the person who's managing your sleep, because everyone's just so different. So we don't want to say you have to do this or whatever. We actually want you and your prescriber or your sleep manager to actually get a plan that's the right plan for you.
You know, like a couple things I want to ask you at night. You know, a lot of patients, including me, wake up. Like right now, I just came from my presentation from London, so jet lag plays significant role on me. And I wake up exactly 2 a.m. And can I use your device at that time? And, you know, a lot of people talk about fragmented sleep. So I know I have to use it 30 minutes before I go to bed. But what if I wake up at night?
So there's two parts to this answer because we get asked this a lot. So there's no issue with you using it at night. And it's not something we do in the clinical trials, but we have lots of patients who exactly the same scenario. They do international travel, and if they waken up with jet lag, they can use the device. And actually, a good proportion of those patients will say, "Hey, I found that helped me get back to sleep again much quicker." So that's one part of it, and that's totally fine. The other part is we would strongly recommend that actually you use the device at the time that your normal sleep should be starting. So let's say you're jet lagged, and I travel internationally all the time. The ideal time to use it is before the time that you would be going to bed in the place that you are going to, almost. So basically, you use it at night before you go to bed at the same time every day during that jet lag period. And what we're finding is, and again, not something we looked at in the clinical trials, but what's been reported back to us is that then a patient who is suffering jet lag, many of those have reported back that actually the period that they normally take to recover is shorter because they're introducing the device to actually help almost get them back on track. Well, it's almost like restoring that kind of circadian entrainment or circadian regulation.
No, that's great, because somebody who used that device mentioned to me what she used that in the plane when she's traveling back to kind of avoid the jet lag when she gets home or to the place of destination, to put it into that stage, sleeping stage.
Because actually, I should have maybe said this also. There's two effects that we see with the device, two very clear effects. So the first is the kind of instantaneous. So when you turn the device on, the part of your brain being stimulated, it actually gives us a sense of kind of rocking, like you're relaxing. It is very gentle, so many patients actually fall asleep with that rocking motion, the same as rocking a baby. But that's actually not the proper benefit of the device. The true benefit is that repeated daily use to actually cause circadian entrainment. So you almost get two positive effects. Many people fall asleep, but actually the best effect is those who use it every day for several weeks, so that they then actually get back to normal sleep.
But tell me, as anything in life, it's a double-edged sword. What the side effects of this treatment?
Yeah, well, I think we're always keen to say this does not work for everyone every time. Any device or drug, even or pill that claims that, I would be very, very suspicious of. But whenever you look at our data, we tend to see about 2/3 of people have what we would say is a very clinically meaningful improvement. So it's not just like a little improvement. It's actually these patients have really changed how their insomnia has almost, how their improvement has been. It's really clinically meaningful. But I suppose side effects, the most common side effect is actually that rocking feeling. So that strictly speaking, that's a side effect. So we have to tell people to stay seated. So that's why we would often say at night when you're watching television is the perfect time, because you're already seated and you can put this on for 30 minutes. And then maybe after that, the side effect profile is very, very good, particularly when you look at what the side effect profile of drugs are. And I would say perhaps maybe some people get a little like dryness maybe with the little pads, but again, less than 1% of people. So overall, very, very good safety profile. Part of the reason actually that we got through the whole FDA process is because it is considered so safe. And then, whenever you compare it to drugs, it's just, totally different when it comes to safety.
But my question to you now, a lot of us are technology oriented, and people come to me and they talk about stages of sleep. Does this device improve deep sleep, REM sleep in any way? Because a lot of people, it's a great way, we get more educated about intrinsic work, but does that affect the stages of sleep?
Yeah, so there was actually an independent study. It was carried out by a group in Japan, looking at exactly this. And what they were able to find was significant improvement in sleep latency. So when people put their head on their pillow, the time it takes them to fall asleep. And also they found that this was complemented by sleep spindles, which is part of the brain waves, I suppose, associated with falling asleep. But then whenever they actually looked at sleep architecture, where they saw the significant improvement was within the N2 stage. So there was an increase in N2 stage. But again, that was a really interesting study. But what we would like to do is really dive into that and actually repeat that study across a large population. And I think we'd look at even including PSG and EEG and actigraphy, and everything. So again, that's actually another future study that we're planning.
For me, I would be very, very interested because, as you know, I do treat sleep apnea and I'm so passionate about the sleep. I wrote a book about that. And among my sleep apnea patients, a lot of them do not see dreams. Yes, it's true. What we see dreams in deep sleep and REM, sometimes people only contribute to REM, but according to different studies, deep sleep also can provide a dream. And people come to me and say, I don't have dreams. And I'm wondering if this type of electric stimulation can stimulate a certain waves after they've been dormant for many years with sleep apnea, if this type device can stimulate those processes, because I think it can be so positive on a hormonal level, on a memory level, brain cleansing level, lymphatic system kind of way.
Absolutely. Yeah, no, I mean, this is super interesting. It's really diving into, the depths of sleep architecture and all the associated, improvements that you get. That we'd be really interested in looking at that.
Yeah, me too. So it's not the end of the conversation. Thank you very much, doctor, for bringing such a great device. You're going to find the information about Neurovalence and Modius Sleep, Modius Calm, whatever treatment you think benefit you underneath this interview. And you can get in touch with company and talk to your doctor and get this device would help you to sleep better without drugs. Thank you.
Excellent. Thank you so much.